Okay, so good morning, everyone, and welcome to our political liaison of January 23rd. I'm going to first begin by identifying any media on the line.
Hi, Donna from the Two Row Times.
Good morning, Donna.
Good morning.
Is there any representatives from the Turtle Island News? Okay, seeing none, I'll then move forward in terms of any additions or deletions to the agenda. And if not, I'll look to a mover and seconder to adopt our agenda for this morning. Moved by Audrey, seconder.
I can.
Seconded by Michelle. Thank you. All in favor? Any opposed? Seeing or hearing none, motion is carried. Okay, we have no delegations for this morning, so that'll lead us into our adoption of the political liaison minutes of December 12th. Looking to a mover and seconder for the minutes.
I'll move.
Moved by Michelle, seconder. Seconded by Greg. Are there any further questions or comments? Okay, see or hearing none, all in favor? Any opposed? Seeing or hearing none, motion is carried. Our next item on our agenda is community supports and services. We do have members of the Wellbeing Task Force online. You'll see recommendation 6.1 within our agendas. So just prior to that, I'll look to Arliss and team, I believe, to speak to this item. Good morning, everyone.
Good morning.
Good morning. Shirley's prepared to speak.
Okay, perfect. Thank you so much. I'll pass the floor over to yourself, Shelley.
Hi, thank you. Good morning, council, community. We are here this morning asking for the approval of our terms of reference. I'm not exactly sure what part of it I'm supposed to speak to. To be honest, this is my very first time, so be kind. Did you want me to go over the terms of reference briefly, or does any council have any questions about the terms of reference?
For community's sake, I think it'd be nice to just to give a little high-level backgrounder and then what exactly we're looking to approve today.
Okay. Did you want me to share my screen with the terms of reference?
Sure.
Okay. Just bear with me here. Okay, can everybody see my screen?
Yes, we can.
Okay. So this is the Child and Family Wellbeing Task Force terms of reference. There was a resolution passed in May 2020 that asked for a task force to be created, bringing leadership together, looking at legislation and working towards healing and wellness for the community. So as you see here, that's right here. We have that listed with the resolution number and the parties that were to be a part of that. And then there was the February 15th and 16th special council meeting that was held to update council and community on the Human Rights Tribunal case against Canada and the agreements in principle for the Six Nations community members. On that date, Chief and Council asked that a Child and Family Wellbeing Task Force be struck, made up of leadership across Six Nations, aimed at working together in unity towards healing and wellness, and that was to be created. And so we began to get to work at that point. We have invited all leadership across Six Nations to join and be a part of the task force. We have met approximately 10, we've had 5 official meetings, but we have also one of the foundational principles of the task force is that there's equal opportunity to participate. So whenever there is leadership who cannot attend, we re-host the same meeting again to make sure that everybody has all of the right information. So far, the task force has come together in creation of the terms of reference. I can read the mission statement here to you all. It says the Child and Family Wellbeing Task Force mission is to work collaboratively with Six Nations of the Grand River governance, administration, and the community in an effort to share information and decision-making responsibilities, to make service delivery specific to Six Nations of the Grand River culture and values. The task force allows for accountability, collaboration, and consistency from Six Nations leadership, community, and governing bodies who are responsible for the well-being of Six Nations of the Grand River families and children. And so then we go into the task force structure. We have a core team and then a larger group. The task force is still somewhat in its infancy because we're waiting for approval of the terms of reference to really kind of get going on things. But purpose is relationship building. We know that there's been a lot of really great relationship and collaboration between agencies already on Six Nations, and we want to move that forward or continue that momentum and continue building those relationships across agencies. So here are some roles and responsibilities: to oversee the all activity related to the development and implementation of the strategic framework and its training, for community prevention response systems specific to Six Nations, bringing all political matters to elected council, any recommendations about specific issues for council to approve or help with political advocacy for the community. There is to be accountable, collaborative, and consistent with all the participants of the task force. So that's really looking at accountability for leadership on Six Nations and doing and supporting the best interests of the entire community. Relationship building and maintenance with internal and external partners. Work with the Child and Family Wellbeing Project Coordinator and Policy Analyst to review and make recommendations on work plans and proposals. So myself and my colleague, we bring all of the relevant information of the topic to the task force, which is the leadership, for them to then make recommendations and do the work that needs to be done in those areas. And then we would bring that back to council. Provide recommendations and engage in active discussions with the task force committee, subgroups, and internal and external partners. Make decisions in unity that support the well-being of children and families from a Six Nations specific perspective. One of the foundational principles of the task force as well is to have something that spans across Six Nations in terms of definition. So we have created, for example, we've created 6 subcommittees to begin the work. And those are definitions and outcome measures, law and legislation and understanding, Bill C-92 and Bill 84 and how that affects the community, and whichever legislation is relevant and appropriate at the time, a prevention service delivery model, community standards, conference planning and community engagement, and data collection. And so those are all issues that the task force has identified as relevant. And so we want to have different subcommittees come together, and depending on which program and which agency is relevant to those issues, then we would create the subcommittees and begin the really hard work in each of those areas. So that way we can have a universal understanding across Six Nations of each of those areas, or how we can support, how can we collaborate and come together in the best interest of the community in each one of those areas. The task force participants, this is everybody who has been invited. Not everybody has come, but this is who it would be open to. This is about collaboration and unity. So there's no closed door approach. It's for everybody who wants to be involved, who needs to be involved, and who is accountable to be involved. Some of the roles and responsibilities listed here. So as I said before, to provide feedback. Provide feedback and input on all activities in the development of recommendations of a strategic framework, community response system for Six Nations, provide recommendations to the core team on requests for political action, which we would then present to council, provide relevant perspectives from the frontline services and community, participate, plan, collaborate with community engagement discussions, planning, and events. First and foremost, be accountable, collaborative, and consistent in the participation of the task force. Assist with communication, information sharing, and engagement as requested and required. Assist with the development and review of work plans and timelines, and participate in the task force meetings and the subcommittees relevant to the development of recommendations. Some of the foundational principles that have been discussed through the creation of the task force and its terms of reference. So this is important for all the leadership who has come and participated. Equal opportunity. Oops. I can't see the screen, so I'm not sure if somebody had a question or was asking a question.
No, I think you're still good to keep going, Shelley, then we'll open the floor further.
Thank you. So equal opportunity for decision-making and participation, accountability, honesty, integrity, professionalism, respect, transparency, and consistency. This kind of goes on a little bit into the meeting timelines and the meeting structure. Depending on what it is the task force is doing, this is going to look a lot different. We definitely wanted to keep the momentum going, and we were meeting quite regularly before the holidays. Unfortunately, there was a lot of outside circumstances that made it a little difficult, and then the holidays. But we're hoping, after the approval of the terms of reference, that we can get back into it in the new year. We'd like to do the meetings bi-weekly to support, as I said, that momentum and keeping things going. Myself and Charity facilitate, and we will bring updates to Chief and Council as required or as needed, or monthly. I think we wanted to have a monthly standing update. We also would bring in terms, if we were working on something specific in terms of the subcommittees, then whichever leadership was leading that, maybe they could come and give an update as well. Talk about external partners who will be invited to attend the meeting as deemed appropriate by the task force. Agendas and packages, all relevant, distributed 2 weeks. So that's all the facilitation work that Charity and I do. And the terms of reference can be reviewed annually and revised as needed. So that is our terms of reference and for the task force. Does anybody have any questions? I can't.
Okay, thank you, Shelley, for walking us through this item. If I can, maybe I'll get to, if I can stop your share screen, just so I can see the number of hands. I'll first begin with Nathan. Looks like has a question, comment.
No question, comment. Well done, well thought out, and I'm going to move this.
Thank you, Nathan, for that. I have a mover on the floor. Is there a seconder? Seconded by Audrey, and I'll further open up for questions, comments. I'm going to check in with Audrey first, and then over to Helen.
Thank you. Shelley, would you please add my name to the list of contacts, and it's under education, Audrey Paulus Bombery.
Okay.
Thank you.
Thank you.
And I think this again, just really quickly, this is a long time coming. I think it's much needed, and this work needs to get started as soon as possible. So I know, Shelley, thank you for walking us through that in terms of the steps to get to this important work. Helen.
Yeah, well, I think Shelley hit the nail right on the head when she said prior to the holidays, they were having regular meetings, but after the holidays, it sounds like they're having a hard time to meet. And that's usually what happens to our task forces. They all gung-ho at the beginning, and then it kind of dies off. People quit coming, or they don't show up, and then task force kind of dwindles down. And first, we don't have a task force no more. So we got to figure some way to make sure that everybody stays involved. Council, our administration, I guess Darren, has to make sure that everybody stays involved on this and attends all of the meetings and does all the work that's required, because there's a lot of work required if you listen to her subcommittees. So that's just my comment. I think it was a really good terms of reference. And I hope it all works out to the best. So I guess it's going to be up to administration to make sure that it's working.
Yeah, I think that's a really good point that you've raised and definitely noted. I know Darren is on holidays this week, but Trevor's here in that replacement to note those, the importance of continuing and making sure the necessary people involved are consistent and that we could start to move on some items right away. I know even Shelley, and thank you to Arliss, yourselves, Charity, even with our first community healing event that we're currently, planning and wanting to get as many people involved as possible. Because as we see, there's been so much, a lot of really traumatic events, a lot of really sad times. And I think that's something that as a community, we have to come together and figure out, what is that best way forward in terms of, our healing path and making sure that we're accountable across the board. And so I too agree. I think it's really well done. I think the terms of reference reflect exactly with what you've given over your high level overview and really just excited to get started. We have to Helen's point, have to bring back that excitement and make sure that excitement stays ongoing and consistent. I see Charity has her hand raised.
Good morning, everyone. I just wanted to speak to, definitely our team would love to be a part of the healing dinner. When Arliss had spoke about it, I was definitely interested, and I know that Shelley would be as well, to be a part of the planning on that. Also, I just wanted to remind everyone that we have a youth conference coming up. It will be at the Gathering Place in March, from March 17th to the 19th. We're anticipating about 100 Six Nations youth to attend, and departments, we probably have 20, 25, 26 people that all the departments across Six Nations elected council, OSTTC, Ganokwasha, community members. It's been amazing, the input that everyone's, River Rocks, some grassroots community members, and it's been so amazing for everybody to come together. And we hope you look out for it and send any youth our way. We're just working on the agenda and the details of what's going to occur there, but there's going to be a lot of amazing things, and hopefully we'll start empowering all the Six Nations youth, but definitely great collaboration between all departments and leadership across Six Nations elected councils. So it's been amazing.
Thank you for that reminder, Charity, and as well for community to know that this conference is happening as well. I know I got to touch base with you over the weekend. Just whatever you need assistance and support from the chief's office, please reach out. I know I'm excited to be involved myself. I know that you've also had contact with our Six Nations Youth Council. So again, it's all about collaboration, really. It's all about partnership and making sure everybody's included. So
That's
really
right.
excited.
Thank you.
Are there any further questions or comments in relation to the resolution on the floor? Again, just for community's sake, I'll read it really fast, but it's been moved and seconded by Nathan and Audrey. Again, whereas the Six Nations of the Grand River Elected Council, following the special council meeting held in January, supports the Child and Family Wellbeing Task Force and its initiatives. And whereas the Six Nations of the Grand River Elected Council prioritizes prevention services as a first response to supporting children and families and invests in the well-being of all of its membership. And whereas it ensures the accountability of its leadership by supporting collaboration between departments to provide the best possible outcomes for families and children accessing services within the territory. Therefore, be it resolved that the Six Nations of the Grand River Elected Council approve the terms of reference for the Child and Family Wellbeing Task Force and support the collaboration of all its leadership. It's been moved and seconded. Are there any further questions or comments? Okay, seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion is carried. Motion to waive second reading.
Wait,
Moved by Nathan, seconder. Seconded by Audrey to waive second reading on the previous motion. All in favor? Any opposed? Seeing or hearing none, motion is carried. Well, thank you so much, Shelley, Charity, Arliss. I also just really quickly want to highlight what a great event it was on Saturday. Thank you so much for allowing me to be a part of your years of recognition within Social Services Department of staff. There's been a number of staff who have been with our organization for a number of years, and as well as our newcomers who are getting trained and furthering this important work, as well as honoring those that we've lost within the department. It was a very touching event, and just want to say nyawa to each of you and your teams for your continued work. We have much more work as now with your terms of reference approved to continue. And so we do look forward to whatever we can do to further support, and look forward to, again, starting this important work. So thank you, and nyawa to each of you. Okay, Council, that being said, I'm going to continue moving along our agenda here. Our next item that we have is the recommendation from the Community Engagement Standards. Sorry if I could just look those online. Who will be speaking to this item?
That'll be me, Chief.
Perfect. Over to you, Trevor. Good morning.
Good morning. Thanks for that. Yes, this is just a progression of the Community Engagement Standards project. Just to recap, Fluid Consulting has been contracted to carry out this project. And now we're at the stage of a Community Engagement Standards Working Group to be created. That will consist of 8 members, and we're seeking one elected councillor to be a member of this working group. This first meeting, the inaugural meeting, will be this Wednesday. So I'm just here today to get the ball moving on this project a little further and the next steps, and hoping a councillor will be would want to sit on this working group. And the purpose of the project is to get more of the community's voice. At the end of the project, that'd be the recommendation, is how do we get more of the community's voice on issues pertaining to the community as a whole. So.
That's great. Thank you, Trevor, for that high-level overview. Are there further questions, comments, council? I think this has been ongoing, where we're getting to this point of the contracting the company, to furthering, again, to Trevor's point of the whole importance of what engagement looks like. I know we've been trying multiple ways and want to continue what works best to get, as Trevor has noted, as many voices involved and heard and further respected, so that we can start to see where we can progress on certain areas. Helen.
Yeah, when they held community meetings a few years ago, I don't even know if it was this term or if it was Ava's term, I can't remember. But they held community meetings on the community standards, and the meetings ran into the same problem as a lot of our meetings. The majority of people showed up are the people that don't want community standards, don't want council to make any kind of bylaws or anything. So we need to figure out how we can reach the rest of the community somehow, to hear what they have to say. So I'm hoping this task force can do that, figure out how to reach, other parts in the people in the community that may want community standards. I think I went to about 3 meetings they had, and that's the way it went. So it was kind of disappointing. So I'm hoping this task force can move in a better direction and try and find ways to talk to other people about what they think about community standards, even though the people there at the meetings knew all of these things were going on, talking about garbage and all that kind of stuff, and bringing in dirt and everything. They still didn't support council making any kind of laws or bylaws or anything like that. So it was disappointing, but that's usually what happens.
Again, Helen, I think you've raised really good points, but I just want to clarify. So that's community standards that I know we've been working through the Justice Department and furthering and wanting to further what that looks like. This specifically is how do we engage further. So this is actually no relation to the community standards, excuse me, that you've talked about, but this is how do we engage further on all various topics.
So is council going to be going through the community standards? Because there was a whole, several of them that I didn't agree with.
Yeah, exactly. So that those will be forthcoming, but at a later date.
Oh, all right.
Yeah. Further questions, comments, Sherry Lynn?
I see there's for a counselor to sit there.
Yes.
If no one wants to sit there, I'll sit there.
That would be great. Is there any further interest from any other counselor? And if not, because I do believe, Trevor, you did say the first meeting is happening this week, correct?
Correct.
Okay, thanks.
Yeah, I would have probably sat there too, but Sherilyn can sit there.
Okay, thank you for that, Helen. I see further hands being raised. I want to first check in with Audrey. I think I've seen hers, and then over to Nathan.
Yeah, thanks, Mark. Community standards are very important, but it's the approach also how you get them out to the people. You don't get a booklet of all your standards you've ever wanted to think of and give it out to the community and say, what do you think? It has to be broken down into smaller pieces so people can digest 3 or 4 of them at one time, and they have to have a place to discuss them, whether it's through radio shows, all your social media. The great big huge community meetings don't seem to work. So maybe we can focus also on smaller focus groups, table talk, that sort of stuff, because we do need to know what the community want. And the more people we hear from, then that silent majority, we hope those are the people that we can attract to this, whether it's starting with family members and they do family groups, but we have to somehow get together. So if you also need more help when you get to that point, then bring it back to council for more help. We're here. Yeah.
I think yeah, exactly, Audrey. You have a good point. Like, I don't want to get caught up in per se the community standards itself. It's how we're going to get there, how we're going to engage in terms of a vast, different areas within the whole community. And I think that's something that is really important. Even right now, like how we've trained, wanting to live stream our meetings, wanting to go online, wanting to make sure how do we engage our elders, our seniors who don't have connectivity or not really technological savvy, and so all of those pieces, I think, is what's going to be encompassed in this work in terms of this working group and how do we proceed. So again, good comments, Nathan.
Yeah, Chief, I would just maybe encourage councillors to maybe read the report again because it goes beyond what's being discussed and really great ideas in terms of breaking through some of the old school kind of methods and bringing forward some fresh ideas. I just went through my emails and I'm perusing through it right now. And the other thing I was going to mention too is just want to make sure going forward, because when we do these kind of engagements, they have to be invested in. And I want to make sure that we're putting the proper investments. I know we got budget days coming up, and I'll be particularly interested to look at what the investments are for this particular piece of work. Because going through the report, it's not going to be cheap. And I don't think, something as important as getting to those factions of the community, we should shortchange ourselves. So one thing I'll be looking in budget days, I'm just going to make a note for myself. And Sherry Lynn, if you do need a backup, I'm happy to provide that backup support, something near and dear to me. As you guys know, I've mentioned this a number of times and gave ideas. So definitely be your backup if you need it there, Sherry Lynn.
That's fantastic, and thank you for that reminder as well, Nathan. I think, and it's really speaking from good grounds, because there's been multiple times where different initiatives that were led by the Development Corporation, they have some experience going out to community and what is the best next best practice of engaging our community, what that looks like. So I think again, really good points being raised, and I think this is a really exciting time so that we can again get to all voices in that what that looks like. Further questions, comments? Okay, that being said, then I'll look to mover and seconder with the addition of including Councillor Sherry Lynn Hill's name within the motion. Again, just really quickly for community's sake, the recommendation reads, whereas the SNGREC, the elected council received a report from the Six Nations of the Development Corporation and Dillon Consulting in 2022 regarding community engagement standards. And whereas SNGREC wishes to explore further effective community engagement standards, as well as strategies for our community, and whereas this work is continuing to be led by the Chief Executive Officer's Office, and whereas the work is at the stage of having community engagement standard working group to begin conducting regular meetings between January through to September 2023 to contribute and guide this initiative. And whereas councillors listed in the Community Engagement Standards Working Group terms of reference to be a member of the Engagement Standards group itself, therefore be it resolved that Six Nations of the Grand River Elected Council select Councillor Sherry Lynn Hill to be a member of the Community Engagement Standards Working Group. Is there a mover to that effect? Moved by Greg, seconder. Seconded by Audrey. Further questions, comments, Sherry Lynn?
Can we add Nathan's name on there as alternative?
Sure. I don't see
Thanks.
that being an issue. Thank you for that. Okay, it's been moved and seconded with that addition as an alternative. Councillor Nathan Wright. I will go to the vote at this point. All in favor? Any opposed? Seeing or hearing none, motion is carried. Motion to waive second reading. Moved by Greg, seconder. Seconder Audrey to waive second reading on the previous motion. All in favor? Any opposed? Seeing or hearing none, motion is carried. Thank you for that, Trevor. I'm going to continue moving down the agenda here. We have recommendations from our CAP team. You'll see recommendation 7.1 in the activity report. Maybe if I'll look to Taylor, Lonnie, and team. I would like to, I see Peter as well. If one of you can give a really high level overview of the activity of the report.
Yes, Chief, this is just our standard monthly. So it includes meetings with the province about, the recent things council would have heard of around, Bill 23, green belt lands, changes to wetlands as well. Meeting with several proponents, aggregate companies, largely a typical report. We certainly welcome any questions council may have.
Okay, thank you for that, Peter. Just really quickly, is there anything that in terms of, flagging on some of these items? Oh, I see Councillor Audrey.
Yeah, one of the concerns I have that I suggest would make it easier to read is to take your briefing note and your chart. And it's really easier to read all the monthly meeting minutes if they're bigger than that. So if you could take the top part here and put it all at the top of each one, and then have this monthly meeting fill your page. Probably not only save paper, but it would be a lot easier to read than where it is right now. But it's nice to see them all there. Some of the things I had some questions on, but it's, as I say, it's really hard to read that way, at least for me. Thank you.
Thanks for that suggestion, Audrey. I'll look back to the CAP team to further look to the format in terms of the report itself. But again, I do think, and I'm glad to see the detail that continues to keep coming forward on some of these pieces. I'm going to go over to Greg, and then I'll go back to Audrey.
Yes, I agree with Audrey. Yeah, I had a general question that and I wanted to know on just a certain level of the duty to consult is. For example, we know that the Brantford General Hospital, although it's probably on lands, I guess they had purchased or own, or they say they own, but that falls within the Haldeman tract. Now they're going to be building a new extension on their hospital. Now, is the CAP team involved at all, or is that a project that's really too small and out of your expertise on terms of the duty to consult? I don't even know if that categorizes as a duty to consult.
I'll start and welcome others to fill in. Yes, there is a duty consult about that hospital. I can't swear, Greg. I think I might have seen it. There's often a tier level. So one, is there environmental concerns? Is there possibility of, a financial accommodation? Is there other things about the project we're concerned about? I think I might have indeed seen that hospital, and I just determined it wasn't worth follow-up from either a financial or environmental perspective.
All right, just a follow-up, Chief. The reason I asked that question is, as you know, and we'll get into a little bit later, we were trying to develop a relationship with the Brantford General in terms of health services. And I think that would clarify our position of what developments happen in the Haldeman tract. And it may assist us in developing a relationship with them on a political level. So that was just basically why I asked that question. But thank you for that info.
Good points, good comments. Thanks, Greg. Back over to you, Audrey.
Yeah, mine is about the last one that you have there about the Grand River bus trip tour from the mouth to the source for overnight accommodations. And it's the last 2 weeks of March 2023. Who is this targeted for? There are 56 seats there. Maybe a little bit more on that would be appreciated.
Yes, thanks, Audrey. It's targeted to the community as a whole. We're basically using a grant we have from Transport Canada to cover the cost for this. So we're certainly confident that we can cover one bus, and this is also an overnighter. So the most substantial cost is a hotel. So we'll see what the uptake is. If there's strong uptake, there may be possibility of a second bus. But bottom line is we're all trying to have it just so the bus tour is entirely paid by this pre-existing grant.
Okay, thank you.
Thank you for that. I see a couple more hands being raised. I'll first go over to Sherry Lynn and then over to Helen. Sherry Lynn.
Okay, sorry. Something's wrong with my phone, sorry. I guess my other thing is the importance of, I see Brant counties on there.
Excuse me, Sherry Lynn. Mark, there's
pardon
reverberation there. It's hard to hear her Greg, and it's hard to hear Sherry Lynn.
Hey, just one second. If I could just have everybody on mute who isn't speaking. Looks like everybody is. Oh, sorry, Sherry Lynn, can you just test one more time?
Can you hear me now?
It's still kind of there, but it's a little bit better. But yes,
Is that a little better now?
we'll have to go with it.
Okay, sorry. I guess I was just about the report. I see Brant counties on there, but also the city of Brantford. I would like more focus on that myself because of all what's going on and really keeping a handle on the development and things that are going on, because we've seen so much development. And I see Brant County, I guess Paris, we see around the new arena, all the development going on there. There's just so much development everywhere. I just think that we're getting left out, and just to be more a better handle on all that development. Thank you.
Sure, if I could briefly chime in, so would it help if for the next monthly, we cover some of the larger developments in both Brant and Brantford?
Yeah, you know what, just as in terms, I think that's a good point Sherilyn's raising, and further to Audrey's comments in relation to the format, maybe we can look to because obviously the surrounding areas is we're always wanting to make sure we have a pulse on what's happening, close to home. So maybe when you're going back to your discussion in terms of the format, we can look at, surrounding areas like County of Brant, like City, like Haldeman and so forth, so that we can kind of flag those right away. I think that might help further in terms of reading the report further. Just another further suggestions onto Sherry Lynn's point, because I do agree with her. I think we need to make sure that we're not, again, getting left out of any important discussions of any projects moving forward. Helen, and then over to Audrey. Oh, sorry, Helen, you're on mute.
The bus tour, is that going to be to go look at the lands at Six Nations, look at the Haldeman Jack?
Oh, yes, part of,
Yeah, because we did one. We took a bus tour, I don't know, way back. We went far as Elora, and then we went down to Port Maitland. So it was a really good experience. We just looked at the different lands that Six Nations really had a say in and stuff like that. So it was really good. I would encourage to give notification to the Confederacy as well, because I know some of them went when we went. So I know they probably would go. And Paul General just took us on a route, and we'd stop wherever, sometimes we'd stop where Six Nations had a piece of land, and we'd stop and he'd tell us different things, and it was really interesting. I'm sure a lot of people would be interested in doing that. I don't know how your tour is going, whether it's going to go through a city or whether it's going to go. We didn't go through any cities. We went right along the river.
yes,
Close to-
it sounds very similar to what you're talking about, trying to keep as close to the river as possible. We're
Yeah.
going to go all the way to the source. We'd hope to have, Phil Montier and other experts to be able to talk, both about the treaty litigation as well as, Grand River and in the territory itself.
Yeah, no, I agree with Sherry or Helen, sorry, in relation to, I know that was very informative as well, getting to further learn about the lands up and down the river. And I think I do agree with her in terms of, trying to get as many of our members as well involved in that. Over to Audrey, and then I see Lonnie has his hand raised.
Trying to get on mute here. Okay, thanks, Mark. I would like to have had the time to sit and discuss this with CAP team, so maybe we can make some time for that for all of these. Some of them I would even like to see a map of where the areas are that you're talking about, as well as I'd like to know what legislation is available for this, and if there's any political advocacy that you want council to do. So it's nice to see these down here, but it would be nice to have it, as they say, as a map, and to be able to discuss and what the plans are. What are we doing with this? That sort of stuff. What's our end game in all of this, and how do we tie it back to the benefit for Six Nations? Yeah.
I think again, further good points raised in terms, especially in terms of that political alignment. I think that's something that we need to, always further discuss in terms of, strategies and so forth. Lonnie?
Yes, I could just add that Helen is right. We did have previous tours of the Grand River when Paul General was the wildlife manager. He used to organize those, and since I've been in his job, we've at least done 3 of them in the past, and very informative. We used to split it into 2 days because you could only do one portion of the Grand in one day without trying to rush, and so you'd have two tours, one upper, one lower. But this case, because we're kind of hamstrung on the funding, we have to get the funding committed by March 31st. So we said, okay, let's do it 2 days, and we'll have a stayover at a hotel probably, or a motel probably in Elora. So, and yes, definitely, councillors should, if you are available, you should try to come on a tour, because it's quite enlightening as to what you will learn about the history of the river and our involvement in it. And also, in regards to consultation, we're still looking at how do we draw the Crown into these consultation discussions. And because the law is that they're the primary body, and I'm talking about Ontario Crown, that should be talking to us. We're looking at some unique ways of doing that, and we'll be able to report back to, hopefully, and I'm pretty sure we will, to the political liaison meeting next month on results of that. We did consult with the lawyers on that, so we got a pretty good idea how we might be able to move forward on that.
Yeah, that's great. Thank you. Thanks for that, Lonnie. Looking to see if there's any further questions or comments in relation to the monthly activity report. I think Peter Taylor, you've got some pretty good suggestions as well in terms of what we maybe want to further see into the next report, and how we can again politically align ourselves best. Further questions, comments? Okay, seeing or hearing none, I'll at this point look to a mover and seconder to accept the November 2022 through till January 2023 consultation and accommodation process team activity report as information. But that was tricky. Moved by Audrey, seconded by Helen. Further questions or comments? Okay, seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion is carried. Okay, thank you, Lonnie, Peter, Taylor, thank you for joining us this morning. Looking forward to the next report. Okay, Council, I'm going to continue moving down the list here on our agenda. I have some scheduling. I would like to just add one more in addition to what's currently on the agenda. The first one is that Six Nations of Grand River Elected Council approve Councillor Sherry Lynn Hill to attend the Chiefs of Ontario Health Strategic Planning Retreat being held on January 31st, February 1st, as well as February 2nd in Ottawa, Ontario. Looking to a mover and seconder to that effect. Moved by Michelle, seconded by Greg. Further questions, comments? Seeing or hearing none? All in favor? Any opposed? Seeing or hearing none, motion is carried. And also, I wanted to add this one further. I do apologize. I should have done it at the beginning of the agenda, but it's just under scheduling actually for today and tomorrow. We thought we already had a resolution, but come to find out we don't. And that's for myself to attend the Roma conference. Christopher has some meetings scheduled with some different ministers. So that starts actually this afternoon in Toronto. So looking to mover and seconder for myself again to travel to Roma.
I'll move that.
Nathan, seconded by Audrey. Further question, comment? Seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion is carried.
I have a
Motion,
question, Mark.
sure. Helen?
When, normally, when we would attend Roma or Good Roads, either one of those, there would be different counselors going. So is anybody else going?
Yeah, so we did again put
Mike?
that out, but nobody was available during that time. So I know in the past, we also had our Director of Public Works attend. So I know we'll be forthcoming with that report on all of those. Yes, there was no availability.
All right.
Okay, can I actually look to a mover and seconder to waive second reading on the two scheduling motions? Looking to a mover and seconder for second reading. Is there a mover? Moved by Helen, seconded by Audrey to waive second reading on the two previous motions regarding scheduling. All in favor? Any opposed? Seeing or hearing none, motion is carried. Thank you for that, Council. I will now at this point go to Councillor Gregg, who is going to provide.
Mark, we didn't waive second reading on the bus or the lands report. I don't think.
Actually, there's no need as it was just for information.
Oh, okay.
Yeah, all good there. Thank you for that, though. At this point, I'll go to Councillor Gregg to provide an update on his report in relation to the physician shortage discussion with the Brantford General Hospital. Over to you, Greg.
Yes, I think you have that in your Dropbox. Has everyone had a chance to read it? Because I didn't want to go through it. It's not that long, but as you know, we're plagued, as other communities are, with our shortage of finding doctors and also retaining them. Sometimes they come in and they only stay for 1 or 2 years. We know that we had a chance to meet with Drs. McNeil and Dr. Goel from the Brantford General Hospital, as well as one of their, I would say, office staff with Lebanese. Her name is Lebanese Numemkavor, if I pronounce that right. She's involved with recruiting of physicians and nurses for them. We had a pretty good meeting. I know that the chief wasn't able to make it. Sherry Lynn also had other commitments. But we had Darren and Jennifer Smith was able to attend, and it was it was just an open discussion. And we tried to basically see where we could work together in some capacity to see if we could find or recruit doctors to come to the territory. One of the issues that was discussed was, well, we had to explain to them too that we're under two systems for health services. We're under federal and provincial. As you know, they would be under provincial, but there is a bit of overlap. And of course, some of the doctors here are paid through OHIP. So it is a provincial payment system. What we did do is, was mainly a meet and greet, try to establish a first contact that would lead to some further discussion. What we did come up with was the fact that Dr. Goel was going to approach an organization called the Primary Care Council. which is an association of primary care physicians. And it is also a sort of a recruitment site in some capacity. So I know Jennifer and Lebanon, our technical staff, will interact and see if some type of a recruitment strategy can be formulated. That's an ongoing situation right now. What has come of this so far is we looked at other options for Gagnos. Gagnos is federal, has a doctor there, maybe half a day to one or half a day a week. Personally, I think that we should keep a doctor there because of federal funding, whereas the White Pines has 3.5 doctors, but I think they're getting another one. Our community as such probably requires maybe 8 physicians. That would be close to what we would really need for our community. We looked at the options of walk-in clinics. We looked at the option of maybe forming a testing center. We have MRIs, radiology, ultrasound, increasing the capacity for testing in blood and urine. Over at Gagnos, again, those are very expensive initiatives. They require funding. They require a lot of administration. That would be on a long-term sort of a look at our healthcare. The other was we looked at the possibility of integrating with this new Ontario health team. They actually contacted for us the executive director, Ben Deenan, and he knows of our situation. So we've got, they've had meetings in the last 2 weeks. I even can give you a further update. They've gotten back to me about the possibility of a further discussion with the primary care council because they had a meeting there last week. There were 3 co-chairs brought up our situation. Doctors Jones, Major, and Dr. Elliott. Dr. Elliott has gotten back to us, and he's going to formulate some type of, I'd say, framework that may be possible. But that will require further discussion. The last thing, I had a chance to have a short discussion with Colleen Montour at the Haudenosaunee Health Service. Of course, she's works with the Indigenous Services, Health Services with Brantford General. And I think there's going to be further discussion with her and Amy Montour because they also want to get involved in some type of increasing the health services here. But again, this is all just preliminary. I plan on getting back to all of those players in the next week or 2, and then writing up a report and recommendation for a possible strategy towards recruitment. I also am going to be meeting with a fellow by the name of Dr. Anthony Dale. He's the CEO and director of the Ontario Hospital Association. And I was going to get the feedback from him on how he finds doctors for various health. And he overlooks all hospitals, whether it's Hagersville, Simcoe, St. Catharines, Welland, Fort Erie, Brantford. So he has sort of an idea of funding, and they're all short. Basically, they're all having trouble with finding doctors. So we'll continue on. And my recommendation for the report was to have myself, possibly Sherry Lynn and the chief, as well as Darren and Jennifer, continue on. We are going to keep Alana and Janet updated. They have a very busy schedule. That was the problem with our meeting, was that we could not get everybody together. We wanted to do this in December. It wasn't possible. We tried right after January. We had shuffled many dates around, but we were able to get Jennifer and Darren there. And I think it was a very fruitful discussion. And I think it's very good that if we can further have discussions and see if we can form some type of strategy to help alleviate our doctor shortage. So that's sort of it in a nutshell. There's a lot of moving parts there, but hopefully I can get something together in the next week or 2 and maybe give you a more succinct and direct report by the I would hopefully buy the retreat. So if there's any questions.
Okay, thank you, Greg, for your report. I see a couple of hands being raised. I'll first begin with Hazel, over to Helen, and I also see Jennifer on the line, as well as Michelle. So let's start with Hazel.
Greg, just for clarity, with this endeavor and the situation as it stands today at Gagneau's clinic, where they only have the one doctor on a Friday. So will any new doctor who comes to the village to perform services, will that be set up in that Gagneau's facility? And will all of these negotiations, however it becomes, do you include in there also the Health Canada portion of that, or how will it all work out?
Well, that's just one of the problems that we have, is that the people we're discussing our problem with are provincial. So we would have to follow a lot of the payment through the provincial models. I know White Pines, that's sort of the structure that they use. And I believe they are getting another doctor in there. They were in the process of, I think before Christmas, of establishing and retaining or getting a new doctor there. But we're in a kind of a unique situation where we have federal dollars, and then we have two different systems providing health services. There is some overlap, but it's very difficult to get them to work as one unit. And that's not the fault of our employees or our directors or anything. It's just the way the structure is. It's very difficult. Yeah, yes, our priority would be to get someone in there in Gagneau's, because that part is lacking quite a bit. And I spoke with Dr. Shaw, who's there. Sometimes he's there Fridays, and sometimes he has to actually only put in half a day. So it's really not a very adequate healthcare service center as it is there now. But the first thing we have to do is actually get doctors that are interested in come here, explain the situations. And I know Jennifer, she's online, she could probably fill us in a little bit more with detail. And she brought up a good point of comorbidities. Our comorbidities are such that they're so much higher than the non-native populations that doctors take a longer time period to basically review all their files, review their health situation, make the proper diagnosis, and move forward. Whereas in some instances where they are off the reserve, where they're working, they can actually determine quickly the situation of the patient and move forward. And that way, where in our situation, it takes a doctor longer. So he's not actually getting paid as the same amount as he would off. So that's a bit of a problem. I think if Jennifer's on the line, she can chime in on that.
Yes, I'm here. So yeah, the way that it works right now at White Pines, we have what we call a blended salary model. So our physicians, no matter how many patients they get to see a day, they get paid the same amount of money each month. So that's what's called the blended salary model. To get a physician over to the Gagneau's clinic within that model, we would have to get increased funding from the provincial government, which I've submitted for, but we're in a waiting game. So where we would have to look at bringing physicians in with a fee for service, it's called. So basically the physician is getting paid for each patient that comes in. They can bill for whatever they see them for and any other actions they have to take afterwards, such as booking referrals, etc. But the issue is, as Greg explained, our community has very, very complex patients that have multiple diagnoses, and they require a lot of time. And it's not necessarily always related to their medical conditions. It's also related to establishing a trusting relationship with their medical providers. So it takes a lot more time to have an appointment than it would outside of the community. So when we bring a physician in at fee for service, they're not going to make any type of income that is worth their while, essentially, to come and work here. So we have to be very strategic and come up with a plan of action to supplement their income, essentially, to make it ideal for them to want to come and work here. So that's kind of the struggle we're looking at right now. What we've done at the family health team is one of our part-time physicians has agreed to go full-time. So we don't have a new physician, but she's gone from part-time to full-time. And we're currently supplementing her income until we can get increased funding. So she will be starting full-time as of next week, and we'll be putting an announcement out to the community about that. So that essentially opens up space for approximately 500 patients, give or take. Obviously, we wouldn't be able to take those on all at once. It does take some time, but it does open up some capacity.
Really good. Thank you for that update, Jennifer. And I think that's where, you know, even to the work, and thank you, Greg, for helping assist with this issue. Because again, I think that's obviously the end goal, right? Is making sure all of our members have access to a doctor. Helen.
Yeah, I just want to thank Greg for his report. I think it was a very good report, and I really appreciate him doing that.
Thank you. I do.
As an added note, I want to do my report as well, because I wasn't signed up right at the beginning when you had it for the agenda, but my report for my housing committee, I want to do that too.
Sure, we can add that further. In fact, we have a few other reports forthcoming.
Just a comment, Chief.
Greg?
Yeah, just a further comment that, yeah, this is, once you get involved with health, and I guess you know, Jennifer understands this quite well, is that you kind of go down the rabbit hole, sort of, once you get involved, looking for different avenues for funding, for physicians, blended funding, fee for service, and so on. And it's a very complex issue here on the reserve. And if we could actually continue, that's my recommendation, is if we can continue with our team to further explore avenues to where we can actually find doctors and get them to stay here. I think that's more of on a political advocacy level. And then I would also like to see too, if there would be more of a longer term strategy, seeing where Gagnos is going to go, where the health teams is going to, what direction they want to go, just so that we can look further down as well. I know the immediate concern is to finding physicians and getting patients seen as quickly as possible. But also I'd like to have a little kind of a secondary strategy towards a little bit longer term. That was just my comment. Thanks, Chief.
Thank you. Thank you for that, Greg. I have further hands raised. Michelle, you have the floor, and then over to Hazel.
Thanks for that. And thanks, Greg and Jennifer. Jennifer actually answered my question, because we know we're in a crisis. Council, what do we need to do? So I look forward to seeing that briefing note on advocating for those funds. But I also wanted to make mention, I've been sitting with the Haudenosaunee Health Services too. And at the same time, parallel to what's going on, we actually need to start recruiting our own. And so that's what I really see, the different partners in the community of Polytech, great, the Haudenosaunee Health Services, they are all working together to actually encourage our young people to pursue health services. So it's much needed, and thanks, Greg, for doing the liaison.
Really good points. Thank you. Thank you for that, Michelle, as well. Further question, comments, Hazel.
Yeah, I just wanted to ask Greg if any consideration has ever occurred regarding a walk-in clinic at Gagnos.
Yes, that was discussed. Those two items that I brought up were discussed with the Brantford General representatives. That it's more administrative. Like that is a more, again, funding and administrative. It is I think that's more of a longer term issue. But it is very possible that that a walk-in clinic, and they brought it up themselves, and they were actually going to discuss that with their primary care council, and seeing how what the challenges are to set something up like that. So that's actually being looked into.
Okay,
May I speak to that further?
Yep, sure, go for it, Jennifer.
Yes, so we have been looking at that. So we're also in the process of renovating the medical center to make it more functional and up to date, because it is quite outdated. So we're bringing in new equipment into the facility, and then looking at housing a walk-in clinic. And not to overstep what you said, Councillor Greg, but it might be a more imminent solution rather than future. Because if we can work together, I have a meeting with Lebanon, who is from Brantford General Hospital. She's the Director of Medical Affairs we met with last week. So she is in charge of recruitment, and she does have some physicians that are interested in urgent care, which is quite similar to walk-in. So if we can get the facility up to date, and our next step right now is flooring, and then we're going to be bringing in new medical equipment, we could look at housing a rotation of physicians that want to work in the community, and we would be providing them with education on culturally appropriate care as well, and providing that as a solution to our current lack of physicians. So from my planning perspective, that is more of a imminent solution than a long-term, to kind of help the community members that don't have physicians right now.
Great, thank you, Jennifer.
Thank you for that as well, Jennifer. Further follow-up or question, comment, Hazel?
Actually, I just think that it would be a good idea for Six Nations, because I think the majority of our people too also have a doctor off reserve, and you never know what's happening in any doctor's life, because my own family doctor was off for almost 8 months, and there was no way you could hardly get an appointment. So those walk-in clinics are helpful, because you get seen quite quickly and your issue gets taken care of quickly. So I just thought if Six Nations had one of those, it would be, helpful to a lot of families who are, sometimes you have a very sick little baby and you need to get somebody to help right away. So just my thoughts. Thank you.
It also reduces the amount of patients we have going to the emergency room, right? Which is a discussion we had with Brantford General. By, collaborating and working with us, we can start reducing the amount of patients that are going to ER unnecessary, that don't need to be there, and start seeing them within our community. And also by bringing access to primary care, we reduce, the amount of sickness in people as well. So if they're seeing practitioners on a regular basis and they have access to them, they're not going to end up as sick and admitted to the hospital. So it kind of works all in a big full circle. If, we do have the support of the bigger hospitals around us, then we can reduce the amount of flow going into their hospitals, right? Which is a huge talk right now about how overwhelmed hospitals are in Ontario.
Good. Thank you for that. Audrey.
Yeah, another long-term solution I'd like to see us look into is a facility on Six Nations that would handle all of this, whether we're looking at a hospital or a large healthcare unit where we can put diagnostic imaging in, and we can do all the things that we need to put into a hospital, and we do a needs assessment to find out what our community really needs and put that into this facility. I know it's not the next day or tomorrow or the next even 10 years from now, but I think if we don't start planning for our own healthcare, and which would mean we able to have enough funding to attract the physicians and all the staff that we need, and start having a plan to encourage all of our people who are interested in the healthcare field to start going to university for that, and to get trained so that there will be people in the workforce ready when this facility is built. Because we have so many of our people going off the reserve, why can't we take care of their needs on the reserve? And and we don't start planning now and looking at it now, and where it's owned by Six Nations community, so that it's ours and we build it to our needs with all our traditional ceremonies and things that have to be there and present for our people. And we could get, keep encouraging our First Nations to become doctors and nurses and all the other staff that you need to fill a healthcare center. But I think that we have to start dreaming bigger than we are right now. And all the things we're doing right now are good. And everybody's doing a good job. And I'm just saying to plant a seed so that we can start thinking about that down the road, because I think we're going to need it. In fact, I know we need it now. Thank you.
Comment, Chief? Just a comment on that, Chief.
Sure, Greg.
Yeah, I did visit the Kateri Hospital in Ganawage, and yeah, they have even overnight stay there for their community in terms of healthcare. They have different departments. And their population is probably a little bit less than half of ours. But they have a very strong, and I think we're going to be working on this as well. I think Jennifer again can chime in on this. They have a strong relationship with McGill University Medical School. They have a family practice rotation that goes through there. So they have physicians, staff physicians that overlook those family practice residents. So that's another thing that's I think in the works, and hopefully we can establish that with McMaster Medical School. And again, like Jennifer may be able to fill everyone in a little bit more on that.
Yes, Audrey, your mind is quite like mine, because that is my ultimate vision, is to have some sort of health authority and hospital center for our community. So we are working alongside with McMaster to try and develop what I'm calling a hub, where we would have like a rotational hub where physicians, nurses, medical students can come through. We have to keep in mind, though, that we have to look maybe beyond just McMaster and have other universities and colleges involved in this as well. I did meet with Colleen Montour and Six Nations Polytech 2 weeks ago, so I'm going to be attending their healthcare event. I'm not too sure if it was a fair or what they were called. So to look at starting, to educate our young children on what healthcare is and how they can go into healthcare for their future and expand that within our community. Start young with our young children and help them understand how they can help our community and what they can go to school to learn. So that is one avenue of it as well. There are also some other communities. There is a community we're looking at right now in Alaska that has a really good health authority, and the way that they move through it, it's kind of an all-in-one where you see your physician, your specialist, your testing. So we're looking at working with them as well to see what we can utilize from their community to make it our own too. So we have to ensure that our creations are unique to our community and our community members as well.
If I could follow up, Mark. I think that's absolutely wonderful. We're on the same page, but if we can get more and more people voicing their opinion, and we'll make this work, because we've got our global solutions. We have people who are already trained in PT, OT, speech. All of this could be one big, beautiful healthcare system, where you get your primary care, you go in to have your surgery, you have a place to go and have PT, OT, and whatever other service you need. A huge wraparound service, so people are not going outside the territory except when if they want to. But it'll all be here for them, and it'll be second to none, where that the standards are going to be quite high, so that it's not going to be a second-rate hospital. It'll be a world-class hospital. And also lifelong learning could very well work with you to do that, because what we're trying to do is encourage kids also to go to school for all the jobs that are needed on Six Nations or will be needed, as well as teaching, all kinds of jobs, and the skilled trades, et cetera, et cetera. So It makes my heart feel good. Yeah.
That's all good points raised. I think, obviously the work that's happening even with the Haudenosaunee Health Services Group, and what they're trying to accomplish as well. I think it all fits hand in hand in how we have to further support our members when it comes to healthcare. So I do agree with the points raised. Just wanted to get back to Greg's report specifically in relation to physicians and the goal of trying to increase and making sure all of our members have access to a physician. So I just want to look to next steps if we can by accepting Greg's report and his recommendation to continue the work. Jennifer and team as well, again, to further update our council as that work progresses. Is there a mover to that effect? Audrey, seconder?
I'll second that, Chief, with a comment.
Seconded by Carrie, and back over to you, Carrie.
Yeah, Greg, just a comment on, I don't know if all the doctors are like that, but the one doctor I had in Caledonia, if you make appointment with another doctor, if he won't take you in like for a week or so, and if you make another appointment with another doctor, you get dropped. He'll drop you as a patient. And the only one, like if you go through emergency, it's okay. But if you go through into a walk-in, that's seeing another doctor, and they'll that's happened to me. So I just wonder if that's the standard, or is that just the doctor's own preference?
Well, yeah, that depends on I think it depends on the doctor, but I think with a walk-in clinic, it can be, I think, made well aware that your situation is not, it's not unique. It happens a lot in our territory, and that there has to be flexibility when patients come in and see one doctor, and having to see one beforehand. I think that that it should have some flexibility that another doctor can see that patient. But again, that would have to be kind of set in I would know, I guess, the culture of that walk-in clinic. Jennifer, do you have any comments on that?
Yeah, so the way that works is because physicians outside of the community, if they're not within a family health team, are paid fee for service, like I spoke to before. So when somebody goes to a walk-in clinic, basically what that's saying to the government is their physician can't provide them the services they need, and that physician gets docked. So they don't get the certain amount of fees for that patient anymore. So there are some physicians that will, take it personally, I guess, and like basically unroster those patients and not allow them to come. It's actually, not really ethical. If a patient needs to be seen and we're trying to, prevent them from going to the hospital, that's what walk-in clinics are for. But yeah, so it does happen. It does happen. I find a lot in the Hamilton, Caledonia area. Those physicians tend to do that a lot. So it is something to be aware of as well.
Thank you.
Thank you. Thank you for that, Jennifer. Okay, it's been moved and seconded on the motion. Are there any further questions or comments? Okay, seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion is carried. Do want to say again, thank you to Councillor Greg, as well as Jennifer and the team that's been furthering this important work, and do look forward to the updates in terms of the progression. So thank you again, Jennifer, for joining us this morning. Have a great day. Okay, Council, I'll shift over to Helen. Would just like to provide an update report on her housing committee. And just as a FYI, Councillor Sherry Lynn and I will also be forwarding a report and discussing our time last week in Milwaukee at the Jade Treaty Border Alliance. So that will be forthcoming. So over to you, Helen.
Okay, I attended the Chiefs Committee on Housing meeting on January 12th. I've been attending this meeting now for at least 2 years, I think. So just wanted an update a bit. I sent my report out to all of the council so they could all read what the issues are. AFN, you know, it's really good to hear all about health and everything that health is doing, but Six Nations is in a housing crisis. And there's so many people that don't have houses, and the rent is so high in Brantford now, they can't afford to live in Brantford. So a lot of them are buying those little sheds that I think personally could be fire hazards, because it looks like it would go up in the flames quite easily. Or they're getting, you know, sad looking trailers, and we're seeing more trailers on the community because people are having a housing crisis. There's a lot of people that probably don't qualify for a housing loan. So we have a housing crisis right now. Just over the weekend, I seen 3 people looking for a house or an apartment or something. And I noticed down at Hank's place on 4th line there, they built about 4 or 5 little houses, and people are renting those. They're just tiny little houses, and people are actually renting them. So people are taking whatever they can get in terms of finding a house. So we are in a housing crisis. Couple that with our land crisis, because people can't find land to build a house. I also seen 2 or 3 people asking for land to build a house, and they can't find any land. So we have those 2 crises right now. And I think we really need to start dealing with what we're going to do and what we can do. And we need somebody to sit down and figure out what we're going to do. Anyway, the AFN is going to be submitting, they did a lot of data and financial assessment on housing needs in Canada. The AFN is going to be submitting a $135 billion proposal to the federal government for housing for First Nations. And out of that $135 billion, Ontario requires 21% of that money to help Ontario. We don't know yet what the feds are going to do for housing money, but that's what they're putting in. We know we probably won't get 135 billion, but hopefully we'll get a good amount of money from the feds for housing. The unfortunate part is, it has to go all across Canada, not just in Ontario. So they're looking at doing that. We're waiting for that. We can't do too much about that now until the feds do their budget. So housing, they did some community engagement. So now housing is just moving forward. People are going to start looking at the chiefs, as you know, in the last assembly went through the housing options for the transfer. And because this was transferring housing, and they chose 3 of the options that were mentioned. So now they're trying to get a cost of those options to let everybody know how much it would cost to do that. I have recommended that Six Nations do its own housing authority so that we're not falling under a third-party management in terms of First Nations housing. So I want to meet with Lily Beaver and go through all of my information, because I've never met with her to let her know what's going on with housing. So I want to meet with her, and I'm going to go through the different options and what everybody's looking at, and how, what direction everyone's taking and what they're looking at. So I want to meet with her to do that. The other concern I have regarding Chiefs Committee on Housing is, well, we talked about Bill 2023. So hopefully when when Nathan met with Premier Ford, I hope they talked about Bill 23, because I think they were supposed to. So we might hear from Nathan what happened there. The biggest concern I have is the added to reserve reform that ISK is doing. The big plan is the plan is that land management, First Nations land management, is going to get transferred to First Nations. And the reforming the added to reserve is part of that, going to be part of that transfer. So I have a real concern with this, the way that it seems to be going. they're moving ahead. Right now, they're ready to start doing community engagements and asking people what it is they want for the added to reserve policy. What do they want changed? But I think INAC's already ahead of everybody and probably already has it done. These community engagement sessions, I don't really think they mean anything. I think it's just, here's a whole bunch of money to do community engagement, but I don't really know if our voice goes anywhere. My concern is the direction that IMAX seems to be taking. So I think we really need to get involved in this. So I'm going to be meeting with Lonnie to run him through all of this as well. To let him know what they're doing and my concerns about this. I'm really concerned that the added to reserve is going to change into, I'm really concerned they're really pushing that First Nations land management and they're pushing land codes. If we do the land management the way they want people to do it, then we're out of the Indian Act. The land management is outside the Indian Act. And I know previous councils had always not wanted to do land codes. Well, they didn't want to go in that direction. So it's really complicated. And so I hope my report, I tried to make my report simple so that everybody can understand what is a land code, what is the First Nations land management, and what all works in there, and what there's going to be 32 sections of the Indian Act that we don't have to follow if we do all of this, because it's turning it all over to First Nations. So I'm just really concerned about where it's headed with this. There's all other different things that in the last report I wrote to everyone, and there's all different things that INAC's doing, reforming, that if you connect the dots, they all lead to land. They're reforming their land registration, they're reforming how First Nations makes their decisions on land. They're reforming everything, and if you connect the dots, like I said, it all leads to land. So I'm really concerned about what they're doing. And so I'm going to meet with Lonnie and run through everything and see what he has to say. You know, if I think we really need to sit down with Lands Resource and figure out what it is we're going to do. Six Nations needs to have a voice in this, because we really, I think we transfer the most land of everyone. Or tried to transfer, and we know that it's taken 20 years to transfer land. So there's really big issues with it. So we really need to get on the ball here with this one. And I'm going to be reiterating the other points that we're changing to that leads to land, just to remind everyone. Because I think that report I wrote was a few months ago. So I feel like I need to remind everybody what they're doing there. Another thing I found too with rereading the letter we got from Minister Hadju not too long ago. That in there, he said they're going to be looking at an alternative governance for First Nations. I don't know if anybody caught that when they read the letter, but I caught that, and I'm thinking, what does he mean by alternative governance for First Nations? Like, what are they doing? And I wondered if that's not the reason that Mark Miller snuck down here and met with the HCC not too long ago without telling us, if that had something to do with that. So that was concerning to me, because it's up to us what kind of governance we want, not up to is. So that was all he said in his letter. I've been trying to do some research to see if I could find anything on, I guess, reforming governance. But I haven't been able to find anything, so we need to keep our ears open. So that's my report. So what I'm going to do is I'm going to meet with Lily and meet with Lonnie and figure out what we can do, and then probably make a recommendation to council on where we should be going. But We are in a housing crisis, unfortunately. We really need to deal with that somehow.
Okay, thank you, Helen, for walking us through your report and your verbal. I think you've raised a number of points of concern as well. Outside of housing, but yeah, as we all know, a lot of it's interconnected. I think the other piece too, and I know Helen, you sent me that one email. I think what we need to do as well from the chief's office is just reiterate and reaffirm our position on housing. As we know, what we've done at the Chiefs of Ontario, just that Six Nations is going about our own direction, and when it comes to housing, as Darren's alluded to the fact of the presentation of the infrastructure task force in what we want to accomplish within the next, hopefully start hitting the ground within the springtime on some initiatives. So there's so many things I think that there's many moving parts to this, but I think that might be one piece as well, just to reiterate our position to the AFN. Obviously, Ontario, Chiefs of Ontario is well aware of that, but I think if we can also just further, just so it's on record on the national level, again, as we know what they're trying to accomplish as well. Hazel has her hand raised.
Yeah, I just want to, I don't know. We all know that the council has lots of banned land here and there around the reserve. And like with the crisis for housing, and I know what Helen's talking about down the road from us here where Hank's place is, they do have little sheds built and people are now renting those. They're quite small. I don't think that they have a bathroom or anything like that in those things because they're just like a shed. So I've been thinking about how can we hurry things along to get something going to deal with our crisis. And I've often wondered about the banned land that we own. If one of those banned owned sites could be serviced, I guess, and made into a survey and then build houses just like back at Harold Road there. It could be done anywhere on a reserve, wherever you're owning land. And I don't think we ever heard too much back from the one presentation. The guy had taken this course at grade, I do believe, and he was in the process of trying to set up some kind of a business where he would build houses, and it would be less than, I think it was around 80 grand that the house would cost. So I was just thinking, can't we all know that GRE gave fire money to help build a fire hall. Because this crisis, if we presented that to GRE, is there a chance that they would do a donation to help get one of those banned owned lands serviced with what's needed and start creating some, they don't have to be big elaborate houses, but it's a place to live is always can be made as comfy as you want to make them. So that's how I'm thinking, to try and get things moving to make more houses for people to live in. So just want to put that out there. Thank you.
Thanks, Hazel. I just I have to just note on your points. This is work that's ongoing. I know just as we had our presentation, I think just before the holidays, of the potential of our apartment building initiative. There's many banned on lands that we've already discussed that are in progress of servicing. So everything that you've noted, there's motion in play, and we'll further get updates from Darren on those pieces. But again, all good points to the discussion of Helen's report, and we'll further update community in terms of what exactly those initiatives look like and the timelines attached to those housing initiatives. So there's a like, as I mentioned earlier, it's a number of moving pieces. to this item. But obviously want to always thank Helen for her commitment in sitting at this table at Chiefs Ontario, because again, there's just so many moving parts to it. Are there any further questions or comments? Okay, seeing or hearing none, I'll at this point just look to a mover and seconder to accept Helen's verbal update in addition to the report submitted in relation to housing.
I'll move.
Moved by Michelle, seconder.
I'll second.
Seconded by Nathan. All in favor? Any opposed? Seeing or hearing none, motion is carried. That does complete our agenda for today's political liaison. Again, there'll be a few more reports forthcoming from some of the meetings that we've attended, as well as we're going to be further attending more meetings next week. So there's please keep an eye out for our next meetings and those updates and reports to our community. That being said, I'll look to a motion to adjourn. I'll need a mover and seconder. Moved by Helen, seconder.
I will.
Seconded by Michelle. All in favor? Any opposed? Seeing or hearing none, motion is carried. Thank you, Nyawa, to everybody for joining in this morning to join us on Political Liaison. I hope you have a great start to your week. Have a good day.